Hello, my name is McKenzie, and I'm the Communications Manager at the Healthcare Collaborative of Greater Columbus. If you wouldn't mind introducing yourself, including your name, what agency you work for, and how long you've been a CHW.
Yeah, so my name is Matthew Demoulin. I work for Franklin County Public Health, and I have been a CHW for a little over 2 years now.
Beautiful. And what inspired you to become a CHW / how did you hear about community health workers?
Yeah, so it's a really cool story. So at the time, I was a program coordinator for a nonprofit on the west side. That's a residential treatment facility for men that are dealing with substance use disorders. And so a big part of our curriculum is doing voluntary work on the west side. And so, we had a relationship with Celebrate One. We were kind of like, every time they had like a first birthday or, some type of event, we were kind of like the manpower. Our individuals that are there would go there and kind of help set up with, tables and chairs, et cetera. And so over my time, working at the place is called the Refuge, we just got, familiar with, a lot of the individuals that work at those agencies. And Sarah, who's a community health worker, and I'm pretty sure she's one of the managers now for Celebrate One. She told one of my colleagues one day, about community health workers in this program through Ohio State. And so he came back to me like right after that. He was like, hey, Sarah was telling me about this, program through Ohio State. And I think it's called community health workers, but I'm not sure. And she said, like if you're under a certain income, you're eligible for free tuition. And so we looked it up, and it happened to be like right before like the new cohort was about to start. So we still had time to apply. And so that's how I heard about it. And, at the time, I couldn't tell you what a community health worker was. Even just reading the description of the class, I still was just like, I have no idea what this is. And, I kind of don't care. And I was just literally just like, I'm just going to take this class because it's free. And I just want to put it on my resume because it's Ohio State College of Nursing. And that was my main objective. And so once I started taking the class and kind of learning about what it is and what a community health worker does, it's kind of like, it's very similar to my role there of, addressing social and health needs. And I was just like, okay, this is kind of cool. But even at the time, like, that was only a little over 2 years ago, like CHWs weren't as prominent as far as just like a need and availability. So even when going through the class, I would still look up Indeed every once in a while, and there may be like one position open or no positions. And so I was just like, well, I'm never going to do this, but I was like, so interesting story. But so it's I kind of became one with not even realizing I was going to become one.
Yeah, that's kind of cool how everything fell into place. But now that you are a CHW, what does being a community health worker mean to you?
Good question. I think the first word that comes to mind is advocacy. I love being an advocate, to my clients and for my clients, especially to them when, their own voice, isn't very kind to themselves, despite, or I say in spite of just, kind of the hardships they have with their lives. And so kind of like sticking up for them, and reminding them what their strengths are and their abilities are. And, then also just being an advocate for them when, everyone else around them, is maybe that negative voice that constantly keeps them down. So I think just overall CHW to me is always about advocacy and being an advocate for our clients.
That's so important, and also such a huge part of your job as a CHW, and something that often gets swept under the rug. So kind of in that same vein, what is your favorite part of the job?
Yeah, so I kind of like thought a lot about this question, and there's so many, avenues, right, that you could probably go down. And I think it just really just assisting my clients and just them eliminating whatever social or health barrier that is in their life. Just from my own experience of just like being faced with an uphill, battle or obstacle, and just like, every little thing or every little defeat could just be like a stressor. And, like those stressors can lead to triggers. And when you have like negative stigma, that just reinforces, things that you've been triggered by. And anytime that happens, it's always just like this negative outcome. And so I really just love just helping my clients, assisting them and just kind of like tackling that hill and just making it a little bit more smaller. And, every time that hill gets a little bit more smaller, it's just like, there's more empowerment and more self-confidence and self-reliability and, positive reinforcement. So it's just kind of like, I love kind of assisting them to start that momentum process. And then you just kind of like sit back and just watch them just go. I think that's just kind of like my favorite process overall that, what we do for our clients.
Beautiful. Do you feel as though in your experience, do people typically have a clear sense of like what that first small jump is or the small identifier that you were talking about?
I mean, sometimes, but I would say it's just a overgeneralized statement, usually not. I just know for myself, like when I'm faced with like a to-do list of 10 things, it's kind of like you kind of just like get overwhelmed by it. And you're just like, I don't even know where to start. And so just like, when we talk about like advocacy, like having someone else there with like a fresh lens or even just like a shared experience, through their own life to be like, okay, this is a lot, but like, let's focus here. This can be like priority stuff. And then this other stuff can be secondary and kind of just help them align and kind of just get the ball rolling. So for some clients, it's very clear on what they should do. And then other people, it's not. And that's just where we come in and kind of help just like, make it a little bit more clear for them.
Beautiful. And what's one thing that you wish people understood about the work that you do?
I think the overall just impact, and that's kind of like an understatement, but like the impact that we have as CHWs that can happen like on an individual level. And, that individual level can then just have like that ripple effect into like, on the community level. Like I think like our duty, like our real duty as CHWs is just not simply to provide resources to eliminate barriers, but like our main goal is really to like obtain client self-sustainability and empowerment. Like my goal is just like, with my clients is just always, I want to get to a point where there's empowerment over their health and there's empowerment over their lives. And this, this believed confidence that, they can navigate life when it gets difficult now on their own. And so I think that's the biggest thing is just like, our goal is really to get to a point where our clients are self-sustainable and they rely and they believe and they have empowerment in themselves.
And you've touched on this a little bit, but how does your work as a CHW impact your community or the community that you serve?
Yeah, so I was initially hired by Franklin County Public Health to work a grant that we got from the CDC. It's called like the Overdose to Data Action Grant. And it was just in the response to, the opiate epidemic and just kind of what it was doing for Franklin County and the devastating effect that it's had. So a lot of my work as a CHW has kind of been in that field. And so I have, I used to have partnerships with treatment facilities, especially like the one I talked about on the West Side. And so a lot of my work, while individuals were in treatment for substance use was just kind of address some common social service needs. Like, do you have all your identification documents? We would work on, and a lot of these places were long-term treatment too. And so it's like, if they didn't have a GED, we're going to, address that and get them, their GED. And then we also had like a focus on the health needs as well. So, a lot of these individuals that were in long-term substance use disorder, haven't seen a PCP or a primary care physician for a really long time, or haven't been to a dentist for a really long time, or, haven't seen an eye doctor and, their glasses are taped 8 different ways just so they can see. And so we address those things as well. And so that was one aspect of my work. I also worked with the city's attorney's office at Franklin County Municipal Court on the diversion program, which was initially created just to support individuals that were in active substance use disorder. And basically because of that, we're committing petty crimes like petty theft and, solicitation and, probably things that they probably wouldn't have been committing if they weren't on, various substances or alcohol. And so in that work was kind of the same thing where, the agreement was that they were eligible, I would do an initial assessment, and if they were eligible, they would work with me for 6 months and we would address those various social and health needs. And as long as they were compliant and, we addressed everything that was agreed upon, that their case would be, dismissed and their charge would be dropped. And, there's a possible to have it sealed off the records. And that's been the majority of my work really for these past 2 years.
That's amazing. And since the pandemic has started, what work have you done surrounding COVID? And have there been changes in perspective that you've seen or observed over the past, what has it been now, year and a half, maybe a little more than that?
Yeah, we're getting close to really almost going on 2 years of this.
I know.
So yeah, really just obviously since, I work for Franklin County Public Health, I've been really immersed in, our COVID response really from the beginning. So initially, it's probably like a few weeks prior to the governor's stay-at-home order that I was activated within our, it's called ICS. It stands for Incident Command System. And it's kind of just like it unifies multiple agencies within the community under like a common hierarchy in a response to emergency, like a national disaster or, a global pandemic. So I was activated in that, and I served on the liaison team. So I was like kind of a point of contact between us and, a local, organization or agency, where I was kind of give them updates and see if there's anything that they need from our end on public health. And then I was also on a team that was tasked with creating and updating a resource guide for all Franklin County residents. And it included multiple, topics. And so I did that for about 4 or 5 months. And then I was deactivated and then reactivated on the logistics team. And, and so like their job, they had multiple jobs, but their main job was really providing food and water to like quarantined families that couldn't get out or didn't have family or friend support to like, bring them groceries or water. And so I was doing that, and we'd also drop off like PPE and like cleaning supplies. And so I did that for a little while, and this was all like on top of my normal CHW work with my clients. And so I was addressing all those things as well. And the biggest thing with that, especially with them, was really food was like a big overarching thing that it really affected everybody, especially like my clients that lost jobs, and now they didn't have the money for food, which was maybe never an issue beforehand. So, and then the second half of that question, as far as was it overall perspective?
Yeah. So what changes in perspectives have you seen or observed in the past almost 2 years now?
Yeah, I think, I think more just acceptance of this is what life is now. I think time is a great equalizer to a lot of negative things, to where like, you might like kind of like butt against it initially. And there's a lot of that, for multiple, reasons. And I think over time, you just kind of be like, okay, this is here now. And so, maybe not just be so against it. What can I do to kind of support it? So I think I've seen a little less rebellion overall.
Yeah. That's good. I'm glad people are accepting it. In the same breath, it's so scary that this is what life looks like now.
Right.
Have you done any work around the COVID vaccine?
Yeah. So initially, I volunteered a lot just with our own vaccine clinics through Franklin County Public Health. I did a lot of like just like data entry stuff, and just kind of helping schedule appointments and things like that. And then, just with my clients is really just providing that educational piece around the vaccine, and just, have an open dialogue with them. I would always ask them, repeatedly too. It's just like, what's your thoughts about the vaccine, and, do you want it? And, if they had a negative response, or they're like, I'm completely against it, I would just ask the why question. Just kind of see like, what was the hindering factor. And the only reason why I asked it was not just, to project whether I was pro-vaccine or anti-vaccine. That's not my responsibility with my clients, but I know with like social media, there's a lot of misinformation. And so if they were giving me reasons that, might not have been scientifically backed, I could provide educational documents, from us, from the CDC, to kind of like maybe better answer those questions to them and just really just get them the scientific facts. So then therefore they, can make the best decisions for themselves and for their families. So there's a lot of this open dialogue. I'd also just like shared my own experience. I ended up getting the vaccine very early once it became available to the public. And, I just shared my own experiences, like, this is how I felt after the first shot. And these were my symptoms after the second shot. And, I shared, my parents' experiences and my wife's experiences. And I explained why I got it. And then I just kind of just like, gave them the material and let them digest it and, help them, or let them, I should say, make that decision on their own.
Beautiful. And I know COVID and the vaccine pathways and housing referrals coincide with other pathway referrals. Could you share a story or two about a client that you've connected with a housing referral, and if you've connected them with any other services?
Yeah. And so I was thinking about this question, and I was, wanted to pose this and kind of flip the scenario a little bit. And I want to know if I could kind of talk about like a housing failure, but not in the obvious statement that it suggests, because like it was not out of the lack of effort, like of one of my clients, or, the lack of effort of myself, but, just for an uncontrollable reason.
Absolutely. The floor is yours.
Well, cool. Okay. So, I will preface and say, like, this is, it's not it might not be a favorable opinion, and it's definitely a heavy topic. And, I'll start by saying, like, as CHWs, at some point, I think we're going to have a client that, is going to ethically and morally challenge us, whether that's something that they are currently doing or something they've done in the past. And so for me, that was like a registered sex offender. And I was just like, at some point doing this job, I'm going to have a client who's a registered sex offender. And, I've thought about like, what's going to be my reaction to that? What type of service I'm going to be willing to provide, for this individual. And so it took 2 years until, I was faced with that dilemma. And this individual was a part of that diversion program through the city's attorney's office. And, when we had my initial assessment, I learned that, he was homeless, and that he also suffered from alcoholism. And, he admitted right away, and he's just like, I'm a registered sex offender. So I understand if you don't want to work with me. And that caught me off guard, because I wasn't expecting that. And I was just like, well, this guy just gave me my out. He just, I could easily call up my boss and, be like, I don't want to work with this guy for personal reasons. But when he said, like, I understand if you don't want to work with me, like you could see like he had some pain in his eyes. And I was just like, kind of like in my mind, like, he got me. Like, and I was just like, kind of like mumbled, like, I'll do my best to help you out. We'll figure it out. And so over the course of the month, I learned that, the grievous act that he committed was over 30 years ago. And I could tell, talking with him that, he didn't try to victim blame or justify anything. He was very straight up, like, I did it, and, I can't change that. And, I feel bad about it, obviously afterwards. And for me, when somebody kind of takes ownership of what they did, I could tell that there's some type of remorse and there's some type of digestion to kind of make themselves better. And so, and then I also learned that, he was homeless because not out of, his unwillingness to work, or because he was an alcoholic. He goes to work 2 to 4 times a day. His buddy's a contractor that lays carpet. So anytime his buddy calls up and says, hey, I got some work, he hops on the bus and gets over to his friend's house, and his friend drives him to the location. And the reason why he's homeless is because he's a registered sex offender and he can't find anywhere to live. And even the places that are, that allow that, and there's some organizations out there doing some work with that, it's hard to find an open room. And then even on the flip side of that too, where I alluded to that, he suffers from alcoholism, and, it's mostly, he admitted, he's just like, I'm not trying to, but, I'm homeless, and I drink, and it just makes me feel better about the situation. But he's also, it's just like, I don't want to drink anymore, and I want help to, not drink. And so it's like, there's a few places that are like kind of long-term residential places that are really good with transition individuals that complete their programs into jobs and housings. And I was like, that's going to be perfect for him. But same thing, like they don't allow him to come in because he's a registered sex offender. And I understand that logic too. And so, the reason why I was just bringing this up is, I'm not really sure, who the audience is here or, who reads the newsletters, but it's just kind of like, at what point is, time served? Is it 10 years? Is it 20 years? Is it more than 30 years? I mean, here's an individual that did something over 3 decades ago, has not had a repeated charge or an offense since then. He wants help. And even though it's just like, I have no empathy at all for what he did, I've developed a sense of empathy for the man he is today, because he's just somebody that's struggling and wants help and he can't get help. And so I just wanted to kind of share that perspective, because, you never know just what speaking out against them. We talk about advocacy. And so, like I said, I know this is like a difficult subject for some people. And, I just wanted to share that. And just, your second half of the question, as far as just, other services, I think anytime somebody has a need for housing, like it's always multiple other things. Like I've never met a single client that was like, oh, I'm good in every other area. I got a job, I can provide food, I got connection to healthcare, all my benefits are good. And the only thing I struggle with is I'm homeless and I need housing. Like it's always just like housing. And, like I've met plenty of people that's just like, they're good in most areas, but they just, have a hard time paying for food. And so like, yeah, housing's difficult. It really is, especially in Columbus. I mean, we all know that there's a housing crisis, and every single time I get a referral or a client that says they're homeless, like it sucks, because there's really no positive thing I can say. Cause I try to be upfront and say like, it's going to be difficult and I'm not going to, tell you otherwise. And it's just hard to look at somebody that's homeless or freezing and tell them like, there's not much we can do. We're going to do everything that we can, but it's super difficult.
Yeah. Well, thank you for sharing that story. It is very heavy, but I think you've left me with a lot to ponder on, to think about. As part of your work as a CHW, I think being able to empathize is something that I've seen naturally comes with people who do succeed in being a community health worker, as well as like on top of the things that are like accessible resources, how to connect people with pathways. But it's such a personal job. And I think that the story that you told about one of your clients relates the two, the personal level and being able to connect with people and empathize with them, seeing their growth over time. I think I'm left with more questions and things to wonder than answers, which isn't a bad thing. But I do want to thank you for sharing.
Yeah, of course.
And that was everything that I have. Do you have any questions, comments, concerns?
No, I'm just, appreciative of the opportunity and for thinking of me. And yeah, this was fun.
Beautiful. Well, thank you so much for joining me today. It's been a pleasure having you.
All right. No, thank you so much.